Hello and welcome to It's Your Business with Mario Toneguzzi. Joining me today is Charlene McBrien Morrison, who is acting CEO of the Health Quality Council of Alberta. Thanks for joining us today, Charlene.
Thank you.
Well, you folks just put out today the first comprehensive survey understanding the experiences of Albertans during COVID. What were the key findings in your mind from this study?
Well, thank you, Mario. And yes, we had a lot of incredible findings here in the survey and some that, yeah, maybe I'll start with one of them. More concerning than most was around the mental health of Albertans compared to before the start of the COVID-19 pandemic. And that's where we found that 70%, a little over 70% told us that Albertans experienced difficulty coping with stress, anxiety, and depression related to the pandemic. And that really manifested itself in some of the challenges that they told us they were facing.
Mm.
So things like loneliness, maintaining relationships with family and friends, difficulty sleeping, and even inability to exercise, all which of course can be factors when it comes to anxiety, stress, and depression. So
Now,
that was one of the more concerning.
Now, when you look at going forward, obviously we're not over this anytime soon. It appears. Are you concerned about that mental health aspect of Albertans and where it's going to be, perhaps in a few months from now?
Absolutely. I think that's a key part of this survey. And one of the reasons that we're repeating the survey is something to keep an eye on. That's an important aspect. And as things either become more restricted or even, less restricted, of course, related to the economy and et cetera, it's going to be important for the healthcare system to keep their finger on the pulse of that one.
So what do we need to do then? First of all, for what's there now and for what may be there in the future, how do we tackle and deal with this issue?
Not something that the survey actually delved into, but it's certainly really key information that we shared with the Ministry of Health and Dr. Dina Hinshaw, as well as Alberta Health Services, who of course provide so much of the mental health services across the provinces. And we really brought that to their attention, that this was something that the survey brought forward. And in particular around people of younger age, so 16 to 24 years old, that's where we saw the highest percentage that were having difficulty coping, and that decreased as age increased. So again, something that we brought to their attention as they're the ones that really are responsible for providing those mental health services.
Any thoughts or ideas of why that age group, that young age group?
Overall, again, the survey didn't delve into why they were feeling that way. Part of that subgroup, they were service workers as well, felt a high percentage of anxiety and depression. And a lot of times those are our younger populations. So
Yeah.
those are the ones that are struggling perhaps to find employment and et cetera. So that could be one of the factors that could contribute to that.
Okay. What else from the survey itself did you find that was interesting?
hmm One of the pieces was asking Albertans about accessing healthcare, and 30% did say they delayed seeking help because they were concerned that the healthcare system might be overwhelmed with COVID. So we looked at that one. That's, again, a fairly high number. And we asked them then, if you did delay getting healthcare, how did that affect your health? And we had around, it would be greatly affected or quite a bit affected. That was about 22%. But those that actually did go ahead and seek medical care or health care, 82% of them said once they were there, they were confident in the steps taken by healthcare providers to keep them safe. So that would be another aspect that we would encourage our healthcare system to look at is once people are there, they're very confident. So how do we bolster their confidence in actually not delaying seeking healthcare when they need it. That's so critical.
Now, when you mention delay of health, you're talking just in general terms, not just COVID related, just general health conditions.
Anything, exactly, for any medical problem. Yes.
Yeah, I presume this survey was taken obviously before the news of the outbreak at Foothills Hospital, right?
That's correct,
That
right. And
what do
yes, and that's
you?
another aspect to consider is, and it would have been before the outbreak at the Misericordia Hospital in Edmonton as well. And so we have to look at what impact that may have on people continuing to delay accessing their health care.
Okay, and what about just in general terms, feelings that Albertans had around COVID itself? What was interesting from what you discerned from the findings?
Right. Well, one of the things, which of course was very important to Albertans, was the restrictions themselves. And so we looked at why would they be more likely to say restrictions went too far? So who is that group? And we saw that it was men aged 35 to 44 that felt restrictions went too far,
Yeah.
or those that were over the age of 55 and lived in a rural area.
Ah, okay.
And when we flipped that coin and looked at restrictions, were they being lifted too quickly? That was expressed by women and those that were well connected virtually to family and friends. So, again, felt very well supported within their homes. And so, that I think is also another important thing to look at around restrictions.
What about the survey look at or talk about how safe people feel today with COVID?
Overall, how safe did they
Yeah.
feel? Really, that was when we said to them, we looked at that from a question that said, how well did they feel protected from
Okay.
being infected from COVID-19?
Mhm.
And 65% said they felt well protected. And then obviously 36 less well protected. And when we asked them about that, why did you feel well protected? And the majority in that group, it was because they followed the guidelines and they felt their overall environment was safe.
Mm.
So that was the majority that said that's why they felt well protected. So that would be our measure of that one.
Okay, then. Anything else you'd like to add, Charlene?
Just to encourage everyone to go ahead and fill out our second survey. It's really important that we can compare between these two time frames. There's been a shift again in public health guidelines, mandatory mask wearing in some areas of our province, as well as school reopening. And so we want to gauge what Albertans are experiencing now. And we do have some specific questions around those two items that we'd really love to hear from people. So albertacovidsurvey.com.
Okay, super. Thanks for joining us today, Charlene.
Thank you so much.
Okay, that was Charlene McBrien Morrison, who is acting CEO of the Health Quality Council of Alberta. This has been It's Your Business with Mario Toneguzzi on Megapix Media. Thanks for joining us today.